How do opioids affect breathing? Have you ever wondered how certain medications can impact something as vital as our breathing? Opioids are a class of drugs that can significantly affect how we breathe, and understanding this is essential, especially when considering sleep apnea. Opioids work by acting on specific receptors in the brain known as mu-opioid receptors. These receptors are located in areas of the brain that control our breathing rhythm. When opioids bind to these receptors, they can slow down the signals that tell us to breathe. This leads to slower and shallower breaths, a condition known as respiratory depression. In more detail, opioids influence groups of neurons in the brainstem that help set our breathing rhythm. By reducing the stimulation to these neurons, opioids decrease the drive to breathe. This effect can be particularly concerning during sleep. Opioids can weaken the muscles that keep our airway open, potentially leading to obstructive sleep apnea. This is when the airway becomes blocked, causing breathing pauses during sleep. Moreover, opioids can impair the body's natural responses to high levels of carbon dioxide and low levels of oxygen. Normally, these conditions trigger an increase in breathing to maintain proper gas exchange. However, opioids can suppress this response, which can be dangerous, especially in cases of overdose. When it comes to sleep apnea, opioid use is a notable risk factor. Opioids can worsen or even induce obstructive sleep apnea. They weaken the muscles that keep the airway open and reduce the brain's ability to respond to breathing challenges. This makes opioid users more susceptible to severe breathing disturbances during sleep. In situations where opioid overdose occurs, respiratory depression can be life-threatening. The medication naloxone, also known as Narcan, can quickly reverse these effects by blocking opioid receptors and restoring normal breathing. However, it is crucial that naloxone is administered promptly by someone nearby. To sum it up, opioids affect breathing by slowing down the respiratory rate, reducing the depth of breaths, impairing upper airway muscle function, and suppressing the body's natural drive to breathe. These effects elevate the risk of respiratory problems, particularly in individuals with or at risk for sleep apnea. Therefore, opioid use is an important lifestyle factor to consider when assessing sleep apnea risk.